Which hormone is responsible for milk ejection during lactation? Correct answer is option B, oxytocin. The normal range of central venous pressure is. Correct answer is option A, 2 to 6 mm of mercury. The safest site for intramuscular injection in infants is. Correct answer is option C, vastus lateralis. The drug of choice for anaphylactic shock is. Correct answer is option C, epinephrine. Which vitamin is essential for clotting of blood? Correct answer is option C, vitamin K. A pulse pressure of more than 60 mm of mercury may indicate. Correct answer is option C, atherosclerosis. Which of the following is the antidote for heparin? Correct answer is option B, protamine sulfate. In case of placenta previa, the primary nursing concern is. Correct answer is option B, hemorrhage. The Glasgow Coma Scale includes all of the following except. Correct answer is option C, sensory response. A small respiration is typically seen in. Correct answer is option B, diabetic ketoacidosis. Which electrolyte imbalance is most likely to cause cardiac arrhythmia? Correct answer is option B, hypokalemia. Which stage of labor is associated with the delivery of the placenta? Correct answer is option C, third stage. A characteristic feature of nephrotic syndrome is. Correct answer is option C, proteinuria. In which condition is the B.Sc reflex positive? Correct answer is option C, upper motor neuron lesion. Which vaccine is given at birth as per national immunization schedule? Correct answer is option D, all of the above. Which is the most accurate method for measuring core body temperature? Correct answer is option C, rectal. Which position is best for a patient in shock? Correct answer is option C, Trendelenburg. The most important nursing intervention during a seizure is. Correct answer is option C, protect the patient from injury. Which complication is most associated with immobility? Correct answer is option B, pneumonia. A patient with TB is considered non-infectious after. Correct answer is option B, 2 weeks of therapy. The most definitive sign of pregnancy is. Correct answer is option C, positive fetal heartbeat. Which is a side effect of aminoglycolic acid antibiotics? Correct answer is option A, ototoxicity. Which type of isolation is required for tuberculosis? Correct answer is option C, airborne. Which of the following is a common symptom of left-sided heart failure? Correct answer is option C, pulmonary edema. Which nutrient is most essential during wound healing? Correct answer is option B, protein. The primary cause of peptic ulcer is. Correct answer is option C, H. pylori infection. Which part of the brain controls body temperature? Correct answer is option C, hypothalamus. Which diagnostic test confirm HIV infection? Correct answer is option B, Western blot. Which is an early sign of hypoxia? Correct answer is option B, confusion. Which condition is a contraindication for oral contraceptive pills? Correct answer is option C, migraine and aura. Which of the following is not a symptom of meningitis? Correct answer is option C, polyuria. What is the antidote for organophosphate poisoning? Correct answer is option A, atropine. Which of the following is a sign of increased intracranial pressure? Correct answer is option A, hypertension. The normal value of serum sodium is. Correct answer is option B, 136 to 145. Which of the following drugs is used to treat bipolar disorder? Correct answer is option A, lithium. Which type of immunity is provided by a vaccine? Correct answer is option B, artificial active. Which condition is characterized by moon face and buffalo hump? Correct answer is option B, Cushing syndrome. Which lobe of the brain is responsible for vision? Correct answer is option C, occipital. What is the incubation period of measles? Correct answer is option C, 10 to 14 days. Which organ is mainly affected in hepatitis? Correct answer is option B, liver. Which test is used to monitor long-term glucose control? Correct answer is option C. Which condition results from prolonged deficiency of vitamin D in children? Correct answer is option C, rickets. Which organ produces insulin? Correct answer is option B, pancreas. What is the normal fetal heart rate? Correct answer is option C, 110 to 160. Which is the most common site for breast cancer? Correct answer is option D, upper outer quadrant. Which blood group is a universal donor? Correct answer is option D, O negative. Which of the following is used to assess fetal well-being? Correct answer is option D, all of the above. The first immunoglobulin produced in response to infection is. Correct answer is option C. Which hormone controls water balance in the body? Correct answer is option B, ADH. Which structure in the heart prevents backflow of blood? Correct answer is option C, valves.